Hi, and welcome to your week 4 post-op video. For my gastric sleeve patients, this is an exciting week for you. You are going to start to have more solid foods. For those of you that have had the gastric bypass, you've probably been doing some very soft, solid foods for a week or two maybe now, and you're going to continue with this diet that we're going to talk about next. So for you gastric sleeve patients out there, this is when you can again have really soft, moist, tender foods. I like to think of things that would come out of your crock pot. So meats and vegetables that you would put in for several hours, 4, 6, 8 hours at a time, to really cook very slow. And so all you would need is potentially a fork to kind of break those meats apart, or to cut a potato or a carrot or celery, something like that. Again, your veggies, steaming really works well because it adds some moisture to those vegetables as opposed to kind of roasting or baking. Some people can do those, but I always say start with a steamed method first, or your crock pot, to see how you do with that kind of texture. With fruits, you can start to do more raw fruit. Bananas, which you've maybe been doing already, are fine as well. Peeled mangoes, peeled pears work well. Maybe peeling an apple and cutting that up really small. Grapes that you would cut in half. So kind of thinking of foods that you would give a baby as they're transitioning to finger foods from your normal kind of pureed baby food. Obviously you have all of your teeth, whereas the baby doesn't, so you can really chew those foods very finely and make sure they're liquid before you swallow. But kind of thinking about that dime-size bite or half teaspoon size spoon of something, so still very small portions of foods. Now, things that you want to continue to avoid include a lot of your tough, fibrous foods, dry foods as well. So again, with meats, anything that you have to use a knife to cut, anything that is really, tough, that seems dry, avoid that. Poaching really works well here as well, as opposed to, frying. Grilling sometimes can be tough, and even baking. With your vegetables, typically avoiding those raw vegetables still as well. Peeled cucumbers, kind of an exception here. A lot of people do really well with that, as they well as with fresh tomatoes usually go well too. So those are a couple you can have. With your fruits, a lot of your seedy fruits like strawberries, blueberries, blackberries, raspberries, those can be a little bit tougher to handle. The next thing I'd really like to talk about is dumping syndrome. And so dumping syndrome is really more common with gastric bypass patients, but it can also happen for those of you that have had a gastric sleeve. And so what happens more so specifically with the bypass is, because we're bypassing a large portion of your stomach and that first part of your intestine, if you eat foods that are too high in sugar and also maybe too high in fat, so a lot of your kind of greasy fried foods can induce this sort of reaction, you really want to be cautious there. So typically 10 grams of added sugar or more is really what induces dumping syndrome. And what happens is those sugars kind of literally dump into the intestines. They just sort of fall into the intestines. The way that they used to be digested and kind of broken down isn't there. And so what happens is all of this water kind of comes in to absorb it. It can make you feel really sweaty, kind of shaky, lightheaded, make you vomit, make you feel nauseous. Some people have diarrhea later. It really kind of depends on the person and the food with sort of what reaction you get. So really, like I said, avoiding foods that have more than 10 grams of sugar is the best way to avoid those potential feelings of dumping syndrome. All right, I hope this was helpful, and let me know if you have any questions in the comment section below.